Hi, everyone, and welcome to the Community Engagement Series. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S.H. Leong Centre for Healthy Children, as well as your moderator for this series. I'm incredibly excited to be welcoming a number of presenters today from the Family and Child Health Initiative team, of which I had the pleasure of attending one of their KT events not that long ago, where they presented on the incredible work that they're leading in the space of pediatric sickle cell disease, which you'll have the opportunity to hear more about today. The focus of what they'll be sharing is around the co-design of a sickle cell disease satellite clinic at the Trillium Health Partners site. Drawing on engagement from children, caregivers, and clinicians, they'll highlight priorities for improving care and outlining the next phase of their work. So without ado, I'll pass it over to the presenters to get started and to do a wholesome introduction of who they are.
Thank you so much, Priscilla, and welcome to everyone. We're thrilled to be here today. Just want to start with a land acknowledgement so we can move on to the next slide. Usley, thank you for doing that. We are the Family and Child Health Initiative. We are situated in the Peel regions, and for those that aren't familiar, we are the City of Mississauga, City of Brampton, and Town of Caledon. I grew up in the Peel region with my own family, and I'm sharing this photo of the Credit River that weaves through the town of Caledon, Brampton, and Mississauga, and was a really important space for me and my family growing up when I think about the importance of child and family health and how I'm connected to the land. We want to acknowledge that our work took place and continues to take place in the treaty lands of the Mississaugas of the Credit First Nation and the traditional territory of the Anishinaabe, the Haudenosaunee, and the Huron-Wendat nations. Next slide, please, Usley. And before we jump into full introductions, we just want to really take a moment to also acknowledge the amazing partnership work that has happened throughout this project and continues to happen. The families, caregivers, and youth that were participants and shared their knowledge, our amazing peer research assistants, Listra and Jennifer, who are both on the call today, who have been instrumental in moving this work forward and making sure that we really are centering lived experience. Our community partners at SCAGO, Ontario Health, Sick Kids, and Trillium Health Partners, and of course, the amazing Leong Centre Community Engagement and Knowledge Mobilization Grant that has helped us to be able to pull people together to share knowledge and continue to move the work forward. Next slide, please, Usley. So this is our team. I'm going to start by introducing myself formally, and then I'm going to pass over to our team members. My name is Dianne Fierheller. I am a social worker by background. I worked at Sick Kids for 12 years before transitioning over to Trillium Health Partners. I went back to school, and I am now a scientist at the Institute for Better Health at Trillium, where I co-lead the Family and Child Health Initiative alongside Dr. Ian Zenley. I'm also a mom to two boys, 13 and 16, a really important part of how I come to this work. So that's me. And I'm going to pass over to Listra to share and to introduce herself and how she comes to the work.
Hi, thanks, Diane. My name is Listra Beausoleil, and my role on this team was a peer research assistant to support the lived experience of co-designing pediatric sickle cell clinic. I'm a registered nurse by background, and I have two wonderful children who both are affected by sickle cell disease. So this work has been true to my heart, and it's been a really great initiative to support, knowing that I can provide direct support and hopefully change to support this work. So thank you, and pass it on to Jennifer.
Thank you so much, Listra. Hi, everyone. My name is Jennifer Siove. I am one of the peer research assistants alongside Listra. I am currently in my undergraduate studies focusing on biology for health science and psychology. I come to this work as someone with lived experience and someone who is passionate about, the healthcare field and forming changes in communities that need it the most. And I feel like through my experience of both science and lived experience, I'm capable of ensuring that the work is grounded in the realities of those living with sickle cell disease, and that our findings are most benefit for those that are going through many difficulties, whether that be regarding their treatment, their experiences, and their overall care in different healthcare sectors. And so, yeah, I'm very grateful to be a part of this wonderful team. And I'll pass it on to Esley.
Thank you, Jennifer. Hello, everyone. My name is Asli Nur. I am currently I'm a PhD student in urban health at the Toronto Metropolitan University. I began my role here as a research assistant. Actually, I started off as a practicum student. I was part of the inaugural Master of Public Health in the Black Health stream at the Dalla Lana School of Public Health, University of Toronto. And I was a practicum student on this project, and then joined on afterwards. And it's been, I think, amazing to say the least, doing this work, working alongside communities, working alongside this amazing team. And yes, that is me in a nutshell.
I'll go next. Yeah, my name is Amer. Wonderful to meet everyone on today, and thank you for taking the time to join us on this noon. My name is Amer. I come to this work as most of my work and career life has been about designing people-centered systems through stories, through research, through strategy. I very much work closely with this team on many projects, but I'm also very much affiliated with lots of other organizations that are in the space of designing people-centered systems. So I'll shout out Partners Community Health as well as Women's College Hospital and a few other hospitals in Ontario. Yeah, that's a bit about me. Passing over to Ian.
Hi, everyone. I'm Ian Zenley. I'm a pediatrician, pediatric endocrinologist, and come to this work as division head and medical director of children's health. So I'm a scientist working alongside Dianne in this team, but also have an administrative leadership role of the children's health program within which this pediatric sickle cell disease clinic is situated. So really excited to be here today.
Thank you, everyone. So you can see that we have diverse experiences and positionalities that we bring to this work, and it really is a partnership and team approach. Next slide, please. So today's session, what we really want to share with you today are the key insights from our community engagement across patients, caregivers, and clinicians. We want to highlight the priorities shaping sickle cell disease care, delivery, and education at the new pediatric satellite clinic at Trillium, and also explore opportunities for collaboration and evaluation as we move forward into the next phase of the work. I'm going to start by sharing a little bit around community partnered research and what it really means to our team, to the Family and Child Health Initiative. I'm going to use a quote from one of our amazing community leaders, Angela Carter, who I saw is on the call. So shout out to Angela. And Angela shared this about community partnered research. Community partnered research isn't just about better outcomes. It's about justice. It's about saying to communities, you are not just a subject of study, you are a co-creator of knowledge, a holder of wisdom, and a vital part of any solution. As researchers, you have a beautiful opportunity. You can be the generation that does things differently, that leads with humility, builds with community, and centers equity at every step. The invitation is there. The question is, how will you respond? And I'll leave that question with you throughout our presentation as we move forward. So the Family and Child Health Initiative, we got started in 2017. Ian and myself were working clinically at Trillium Health Partners in one of the pediatric clinics, and we're doing a lot of work alongside the community. And we got this opportunity to start a research program that was focused on family and child health. And our first sort of piece of how we got started was we decided to go out into the community to understand what does family and child health mean to children, youth, families, community partners, organizations, and what are the priorities that Peel Region is really seeing in this area. And so through those conversations, we started to build FCHI really to support the health and well-being of children, youth, and women, families, and communities in the Peel Region through research and community partnership. And we're going to share a little bit more about FCHI throughout this presentation. And through that engagement, I always like to share this slide. We were invited by many community leaders to join community response tables. So when you see these circles here, these are cross-sectoral partnership tables that exist throughout the region of Peel, and they're focused on different priority areas. One of our community leaders said to us during this time, academic institutions need to rethink how they do research in partnership with community agencies. And really what we were invited to do was get off the sidelines, get out of the hospital, and join the community in these priority areas that already existed. And so that's what my role as I transitioned from a social worker into a scientist was, to take that community development, to sit on these tables and really work alongside our community. And we were able to also co-design projects alongside our partners in these priority areas, and continue to build and grow in that area. Now I'm going to pass over to Dr. Ian Zenley, who's going to let us share a little bit about how this work got started at Trillium. Over to you, Ian.
Thanks, Diane. The Pediatric Sickle Cell Disease Clinic at Trillium Health Partners it's actually just over a year old. So through some advocacy work done by the Sickle Cell Awareness Group of Ontario, to the Ministry of Health, supported by Ontario Health, and specifically through the Black Health Equity stream of work that was being done at the provincial level, there was a recognition around the inequities and lack of access to care for people living with sickle cell disease. And in partnership with SCAGO, Trillium Health Partners applied for and was successful at receiving some funding to launch a pediatric sickle cell disease clinic at our organization. We had been caring for people living with sickle cell disease for many, many years. However, we did not have a dedicated clinic for the pediatric group of people who were using our services within the institution. And so with that funding, we saw a really exciting opportunity to think differently and to engage community in the co-design of clinical services from the ground up, recognizing some constraints from funders and also related to being a clinic in a hospital that has some age to it and space constraints, as we all understand when we are existing within our current physical structures. We really wanted to think differently about the services that might exist within that physical space and work with people with lived experience to understand their priorities, their experiences, and incorporate that into our design of our clinic. And so with funding from our pediatric program and in partnership with the healthcare professionals who had partnered on this application, including Dr. Ann Bayless and Kathy Skelly, our director of the Women's and Children's Program, and Jennifer Restivo, our manager, we launched a multi-stage project to engage lived experience in co-designing the services that would exist at Trillium Health Partners. We established a regional sickle cell disease network and with healthcare providers, youth living with sickle cell disease, their caregivers, community partners, and researchers. We gathered input and through co-design activities, and we hired and onboarded peer research assistants. And our two wonderful peer research assistants, Jennifer and Lister, are joining us today, and you'll hear about their experiences further on in this presentation. We then conducted co-design workshops using a future workshop method where we engaged young people living with sickle cell disease and their caregivers, as well as health and social services providers, to understand some of the problems that currently exist related to pediatric sickle cell disease care, including inequities in access, stigma, discrimination, failure to recognize pain and appropriately treat pain, lack of transition services to support pediatric to adult care transition, and lack of access to adult healthcare providers as well. And then we took all of those findings that emerged from those workshops, analyzed them, collected them, and developed a report with recommendations that is hot off the press to be launching today and available for all of you to see and download and read at your own speed, and interest. And we hosted a community knowledge mobilization event that Priscilla had spoken to with funding from the Leong Centre to bring together community and think about what the next steps might be for this project. Next slide. Over to you, Jennifer and I guess me and then Jennifer and Lystra. So just to give a little bit more detail about the future workshop model or method. So this is a 3-phase participatory method that is used to generate creative democratic solutions to social organization or policy problems. The way it looks is that it starts with a critique phase, which is essentially a problem identification phase, where barriers that exist related to current sickle cell disease care, which Lystra and Jennifer can speak to much better than I can, are surfaced. They're surfaced in each one of those workshops. And as we mentioned, there was a workshop with young people living with sickle cell disease, caregivers of people living with sickle cell disease who may have had lived experience themselves, as well as healthcare professionals and researchers. Then we take those problems or those barriers that have been identified and move them into what's called the fantasy phase, which is a blue sky, aspirational, if you could wave a magic wand and change the way that care looked like and experiences looked like with people living with sickle cell disease, that's what is generated from that second fantasy or dreaming phase. And then the third phase is where we come back down to earth. So we've been moonshot, blue sky, envisioning the ideal state down to what the implementation of this could look like. And that is where we look at the certain constraints that exist within our healthcare system, within the way that we provide care. And within those constraints, those design constraints and those guardrails, we actually vision out and develop actionable next steps for care. And we had done this specifically for Trillium Health Partners, but we also recognize that we are, which I did not mention at the start of this is a clinic that we developed in partnership with Sick Kids. So Sick Kids is the center of excellence. And we, as a satellite program of Sick Kids, actually share care. So people who come into our clinic will also go to the Sick Kids clinic as well. And we have a bit of a shared care structure process there to allow for the movement of people accessing care in both spaces, facilitated by a shared electronic health record. And so this work is done within the context of a Greater Toronto Area Sickle Cell Disease Implementation Committee. There were other existing satellite clinics at Scarborough Health Network and William Osler Health System, and then other clinics in the province. And that's done more broadly with the Ontario Health Sickle Cell Disease Community of Practice. So there's more of a local focus, regional focus, and then provincial focus on sickle cell disease care. And our recommendations, although local to Trillium Health Partners, have wide applicability to other systems and other hospital settings. And we were really excited to see that and launch that report today. Next slide.
Thank you, Ian. So in terms of the youth workshop, we did implement the 3 phases that Ian discussed, which were the critique, the fantasy, and the implementation phase. And so within the critique phase, we saw how, the youth mentioned a few fears that they've had, such as like the fear of needles, sensory discomfort when it came to like nurses' cold hands or having too many healthcare professionals in one room at once. Some even mentioned how far parking would be and how much they would have to walk to actually make it to their appointments. Other ideas, such as feeling unheard or not being given options when they're the ones that are the patient, was an interesting concept that was brought up as well. A lot of youth have talked about the long appointment waits, as well as how long they would have to wait in the ER to get a bed, especially when they were going through a pain crisis. For those in the Peel region, the most common critique was the amount of traffic that it took for them to make it from their houses to downtown to Sick Kids for their appointments, which resulted in them, often being late to their appointments. More points that were interesting to note were certain institutions and hospitals were more disliked and others were more liked due to the different treatments that they would experience. And it was interesting seeing that the younger youth as well were able to notice that difference. And for the older youth, we've seen how change was drastic from the pediatric to the adult hospital and how abrupt that experience felt for them. And so when it came to the fantasy phase, the youth were able to express themselves through any means, whether that be drawings, as you can see on the slides, or like Post-its. So we really thought that using these methods would really allow the youth to express themselves, without limits. And so essentially, we saw how they've emphasized making the clinic a place of comfort and warmth and creating an inviting atmosphere for them to be in. And that included stuff such as colors and familiarity, including posters and toys. Um, as we can see on the slides, we've seen the great ideas that the youth had, such as Superman visiting the hospital with beds and elevators. Some mentioned even swimming pools for patients and having music in the clinic. And so, really allowing the youth to think above and beyond allowed us to see what an ideal clinic would look like in their eyes and what are the things that can make them comfortable and less nervous when going to an appointment.
When we look at the caregiver findings, a lot of the caregivers voiced, very similar concerns. One of them being the inconsistency across hospitals that are not specialized in sickle cell disease care. Typically, families travel to get to specialized hospitals such as sick kids. However, there are times that is easier, but they do fear that there's always inconsistency in care there, long ER wait times, and hospitals just not being specialized to treat sickle cell disease the way that specialty hospitals such as sick kids would. And they voiced the concern that these hospitals should be practicing according to the standards that are set out by Ontario Health. However, they note that they clearly are not, which, becomes difficult and challenging for families or caregivers to have to continue to try to advocate for their children. They voice concerns around the need for support around advocating and communicating with hospitals and providers, because they find that it is challenging having to always repeat yourselves or repeat your story, share your concerns, and the need for advocates to help support that would be beneficial, until your local hospital is more well versed and specialized in following these standards. They also voiced one of the big concerns caregivers voiced are the challenges for the youth transition into adult care. There's a major drop off when youth transition. Parents fear and worry that, they've seen and heard many experience of the care from pediatric to adult. The experience is poor, and they find that there's a decrease in the quality of care when you transition. And so, it's a real fear for parents, and they want to see better support around that transition piece of their children transitioning from pediatric to adult care. So similar, they definitely voiced their concerns, but also, when it came to the fantasy phase, definitely had great ideas around how we can better improve care with things such as having advocates, having the support around transitioning, to really help with ensuring that quality care is provided.
Thank you, Listra. Alongside engaging children, youth, and caregivers, we also held dedicated clinician workshops to better understand what the clinicians were seeing within current sickle cell systems of care and what they felt needed to change. We held these workshops virtually for the clinicians, using collaborative whiteboard activities. Clinicians reflected on what an ideal pediatric sickle cell clinic could look like and feel like beyond just the medical treatment. And what really emerged strongly was the importance of culturally safe and relationship-centered care. The clinicians emphasized the need for welcoming and less intimidating environments, and spaces where the children and the families felt emotionally safe, represented, and just genuinely listened to. And they also spoke about the importance of a comprehensive support system. So this included everything from psychosocial care, peer connections, peer supports, transition supports, and coordinated services that would reduce fragmentation across hospitals and community settings. Another major discussion focused on visibility and representation. Clinicians reflected on the importance of children and youth seeing themselves reflected within the healthcare spaces. And also educational materials and support systems. And, what particularly meaningful, what was particularly meaningful was just how I think closely the various clinicians' reflections aligned with the children's reflections as well, the children and the youth and the caregivers, because they also had already shared through similar things throughout the co-design process. So across groups, we really saw that there was a shared understanding that improving sickle cell care requires trust, consistency, equity, and just a more humanized approach to care delivery. And so as we began analyzing the findings across all workshops and the engagement activities, several shared themes consistently emerged throughout all workshops. The first was equity. Participants spoke openly about things such as, racism, anti-Black racism, stigma, dismissal, and inequities experienced within healthcare systems. The families emphasized that sickle cell care must move beyond awareness alone and more towards accountability, cultural safety, and equitable treatment. The second theme was trust. Many families described, previous negative healthcare experiences that shaped how, they approach hospitals and healthcare systems as a whole. So rebuilding that trust was identified as essential, and participants emphasized that trust is built through listening and transparency, consistency, and meaningful relationships with communities. Consistency in care also emerged strongly. Families wanted standardized protocols across hospitals, particularly related to pain management, which frequently came up, communication, and again, transitions between pediatric and adult care systems for those that had already transitioned or were about to transition. So support beyond the hospital was another major theme. Participants discussed the importance of peer support, again, navigation services, advocacy. We heard about school supports, mental health resources, and just stronger connections between, again, that healthcare and community organizations. And finally, participants emphasized the importance of child and family-centered care. Children and youth described wanting spaces that felt like warm and colorful, welcoming, less medical, less clinical, and reflective of their own identities and lived realities. So caregivers and clinicians similarly emphasized the importance of compassionate, dignified, and responsive care models. Yep. So on August 9th of last year, we held a fun-filled summer event, and this is where we held the children, youth, and caregiver workshops. We did not host them virtually, and so it was fun, to say the least. The event served as an important continuation of the co-design process, and it included both youth and caregiver workshops. And just activities and interactive, space. It was an interactive space beyond the workshops as well. And one of the major goals of the day was to create that environment that felt, again, like welcoming. It didn't feel like it was, medical or like that research type of, structure. While also, providing opportunities for participants to really share, again, their experiences, reflect on the findings, even in that group setting, and further build connections with whether it was the booths, whether it was other individuals. And the event included, so I guess we can move on. It was fun, lots of food, good energy. It was a very hot day as well. And on the November 15th event is where we, shared the findings. We titled it Visibility Through Lived Experience, because the topic of visibility, again, kept coming up throughout the workshops. And so the event was intentionally designed not only as a presentation of findings, but a space, again, for dialogue, storytelling, and continued community engagement. Throughout the evening, participants moved through interactive learning spaces that, reflecting on, not only findings from the workshop, but, just to engage and shared feedback. We had 4 sessions, so we had 4 zones essentially, and each zone was led by those with lived experience. So we had, sickle cell and mental health, and that was facilitated by Dr. Lance Archer, and participants explored the emotional and psychological realities of living with sickle cell. The second booth we had was focusing on, affirmation building and storytelling, and that was facilitated by Simone Wright, who was an educator and artist. And in this space, they were able to reflect and, continue just that storytelling. The third zone was led by the lovely Lystra and Jennifer. It was called Sickle Cell in Action, and it allowed, again, engagement. Lystra and Jennifer were able to share their own perspectives. There were some activities with like ice, and it was amazing. And the fourth zone was the arts-based learning, and that was facilitated by an amazing artist by the name of Josephine Fosua. And participants were able to express themselves through painting, and she also shared her own, her own work. You could see some of the images right there. And so the participants at the event were able to rotate, spend a few minutes at each zone and then rotate afterwards. So what emerged throughout the evening was a strong collective commitment toward building sickle cell care systems that are, again, equitable, not just in speech, but really, driving that point, that are, again, culturally relevant, culturally safe, relationship-centered, and community-informed. So the slide here highlights the launch of the community report, and in this report, you will see the reflections and the voices of the children, the youth, the caregivers, clinicians, advocates, everyone who was involved in this project, and community partners who participated as well. So rather than positioning community members as participants, again, this work approached families and individuals living with sickle cell as knowledge holders whose lived and living experiences are critical to shaping future models of care. So whoever is on the call, we can drop the link as well in the chat, but you can scan the QR code and it should take you to the report itself. Okay, and thank you. I'll pass it on to Umair, who will close it up for us.
Thanks so much, Asli, and for everyone else. Like, you've heard such fantastic work that I hope kind of conveys the amount of time, motivation, passion that this team has brought. So congratulations to the team for the community report and for all the work. What I want to do at the very end is just kind of like wrap up on what this work is going to lead towards, or what we hope it's going to lead towards. And one part of that is really thinking of how this work, the kind of the model we built of co-designing a clinic of sickle cell disease, how that can kind of translate and form and influence provincial priorities of sickle cell disease care. Sickle cell disease care is one of those provincial priorities, and lots are changing, hopefully, and we want this kind of to be a model for other areas and other centers to take and influence and develop sickle cell disease care for their context. That's one part of it, and we're exploring opportunities to operationalize that as well. But the other part of it, we're really excited that we're going to be, of course, having developed this model, we're going to be doing an evaluation over the next year, over 2026 and 2027. We are currently in the process of working with the clinic team who provide that care to co-design what that evaluation looks like in a way that is also practically feasible, but as well as appropriate and meaningful for the patients and the caregivers and the parents that we will be talking to. Some of the questions we're working through with the clinic are what outcomes are going to matter most to family, youth, and clinicians. How do we measure equity, trust, and continuity? And of course, as you've seen as part of this work and all the work we do at FCHI, our pre-research assistants, lived and living experience are central to the work. Our community partners are central to the work, and we want to continue to explore where are the opportunities to engage those pieces as we also do a clinic evaluation. So some really exciting stuff. I hope we, maybe next year we'll have an opportunity to explain some of this stuff back at this group again. But that's all what we have in store, and we appreciate your listening. And I'm going to hand it back to Dianne for any closing thoughts.
Thanks, Umair. And we'll go back. Yeah, this is an upcoming project. Maybe we can drop this at the very end. But what I wanted to say was the other sort of piece that is coming up. So we have the evaluation, but we're also excited that we are going to be able to move forward with some of the ideas. And really, Lystra and Jennifer were central as we were trying to make sense of the findings. What's our next step? What could be, another grant opportunity that we've now come alongside so many partners that we can continue to expand. So we were able to receive additional funding through the Leong Centre. Thank you. Shout out to Leong Centre to keep the work moving forward. And over the next year, we're going to be doing co-design sessions to really build out a larger grant. And so, thinking of the CAHR project grants, where we can bring lived experience, sickle cell warriors, caregivers, clinicians, researchers together to co-design what that grant looks like. And the focus is really looking at that education piece that I think Jennifer and Lystra both spoke to across systems. So again, what is the information that we need to be providing to emergency departments, to schools, to primary care in order to really improve what sickle cell disease care looks like across the integrated system. So that is also the next step, which we're very excited about. And for those of you on the call, if you're interested in getting involved and learning more, you can absolutely reach out to us and get involved. So with that, I'm going to just pause. We just shared so much information. Would love to open it up for any questions or comments to hear about the work that you might be doing in the community. We're going to now hand it back to Priscilla. I don't know if you're facilitating the questions, but back to the group.
Thank you so much, everyone. This was such a great presentation and update on the work that you're leading as well. Congratulations on announcing the launch of your community report. I am very much going to be reading this after today's presentation ends because I'm curious, diving a little bit deeper into this work, and look forward to having you back perhaps this year, next year, this time, to share a little bit more on the next steps of this work. So I'd like to open it up to those on the call. Please feel free to raise your virtual hands to pose questions to our presenters today. You're also welcome to enter your questions into the chat, and I certainly will keep an eye out for those questions as well. Perhaps I will get things started. Oh, Angela, thank you. Please feel free to unmute.
Hi, everyone. Great presentation. And yes, I was attended a couple of these sessions, so I'm really happy to see where you're moving towards. And my question really is, how are you, what training is in place to ensure that throughout the hospital, from emergency right through, understand how important it is to know the standards and to understand the what is necessary for appropriate care for people with sickle cell.
Great question, Angela. I'm going to turn it over to Ian in his leadership role to talk a little bit about that, what that looks like across Trillium.
Okay, thank you, Angela. And if so there's a lot of work happening across the entire organization. So just to provide a bit of context, and let me know if I don't answer your question exactly how you're asking. So there's work that's happening in the organization, there's work happening in the community in partnership with other community agencies. For example, LAMP Community Health Center also receives some community funding for pediatric sickle cell disease. So we've had some ongoing conversations related to how we can continue to have a sort of shared care model between Sick Kids as the center of excellence, us as the community clinical location, so families can receive care closer to home, and then also integrated with primary care and prevention. And then what we have right now is we have a pediatric clinic, and we are looking at opportunities to create an adult focused sickle cell disease clinic as well. And with that, we have an opportunity to support the entire life course at Trillium Health Partners. So our organization, as a pediatrics program embedded within a large hospital system, we have the opportunity for care for people really from birth until end of life. And so in that way, there could be some really nice opportunities for continuity of care. I don't have operational oversight of the adult hematology program, of course. So this is work that's being done in partnership with them. And right now it's really just exploratory, and there are some logistical challenges with launching that dedicated clinic at Trillium Health Partners. But the adult medicine and hematology programs are really seriously looking at that and what that opportunity might look like. Similarly, we're also positioning this work within the broader focus on women's and children's health. Some of you may be aware, and many of you may not be, that we are at Trillium Health Partners launching what we're building now, and we will be opening in the early 2030s, what we're calling the Shaw Family Hospital for Women and Children. So this really continues to push forward our strategy around integrated health systems, supporting families and children and women's health in a very different way. And so that operational and functional planning is underway. And as much as we can continue to take this piece of work as an example of how we will continue to co-design services as we plan out the strategy for that new women's and children's hospital, which will be situated within a larger Peter Gilgan Mississauga hospital. That is the right opportunity at the right time for us to start doing this work. We did this similar work in our pediatric weight and health program many years ago, and now we've done it in sickle cell disease. We need to continue doing this work. This work doesn't stop, as Umair said, with this project. We'll continue to look for opportunities for funding and work with the clinical team to continue to move this work forward around community engagement and co-design. And then we're just always looking for opportunities as a research team embedded at Trillium Health Partners to continue to advance services and programs in a very similar way. Did that get to your question, Angela?
To some extent, but what I really was getting at is we know, and this is from reports back from people with sickle cell, that very often when they go to the hospital, and here I'm talking about here in the region, that people do not understand, and many people do not understand, even at emergency, what they're experiencing, and very often they're left in a long wait list, which exacerbates the problem, because if they're not seen within a specific time, the treatment takes a much longer time. So how are you rolling out training to these areas to ensure that anyone who's coming in, because when you talk about having a clinic here at THP, people are going to expect that people automatically or immediately know what to do. So is training going along with this at the same time?
That's a great question. Sorry, I didn't answer. I meant to, but I kind of went all the way to the Women's and Children's Hospital plug. And now circling back, thank you for bringing me back, which is why I wanted to close the loop with you. So what we've done alongside the implementation of the clinic is that we've looked at our protocols for care in the emergency department. So one of our pediatric emergency department lead, Dr. Alicia Jamal, worked with our pediatric inpatient lead, Dr. Erin Colbert, with Ann Bayless, our pediatrician, to look at standardizing some of our just order sets. So how we care These are like, this is medical language, basically putting in place the evidence-based approaches to recognition and treatment of conditions like a pain crisis, for example, or acute chest syndrome. So with the rollout of those standard medical approaches, there has been some education. We've done some pediatric rounds for our children's health program related to sickle cell disease. We also had a quality and safety rounds, which we call morbidity and mortality rounds, because there was not a great experience, putting it mildly, of a teenager who'd come into our organization and wound up developing acute chest, was transferred out, and there were a lot of opportunities around care there. So there's been some education. There needs to be ongoing education for sure. And I think some of I don't want to speak for this team really. However, some of the things that we've heard from community and we've heard from SCAGO, and Listra, Jennifer, please speak up about this, is that we do need to continue to do ongoing education for sure with healthcare professionals and people who don't live with sickle cell disease in general in the public, so that there's better support, there's better experiences across many, many spaces, not just healthcare. So we can look at the healthcare processes. This is a journey, this is a learning journey with our organization. And having the funding for the pediatric clinic and the work that's followed it is a start, but it's still a journey, and we still need to do that important education. Back to your point. I don't know, Lister, Jennifer, did you have any other follow-up comments about the sort of thoughts around education?
No, I think you're right in terms of like it is a journey, it's ongoing. Just because we have the pediatric clinic doesn't mean everything has, been dotted and crossed off. I think it does take time, and so and having that experience with my own children and having to access care locally recently at Trillium. The benefit of having a relationship with the clinic staff has helped to navigate getting through the ER and advocating. So that piece is great to have, knowing that, we do have care. They do access care at the clinic, at the pediatric clinic at Trillium, helped us to navigate that ER a little bit better and quicker, with the team helping us to, touch base with the ER, letting them know, like, they have a patient that's coming in, and just also advocating for different tests and certain things that they should be doing. So that is a benefit to help with that advocacy piece and feeling a bit more confident with accessing care locally. But certainly there is more work to be done to really make that streamline and making those standards really come to life.
Thank you so much for that question. I see that we have another hand raised. Would you like to unmute and ask your question, Stephen?
Yeah, sure. Thank you. And thanks to the team for the presentation and the amazing work that is ongoing in the pediatric SCD. So my name is Stephen Adumbiri. I'm a PhD student in nursing science at the University of Toronto. But what's relevant is that recently I joined the Sickle Center for Global Child Health as an academic fellow. And my role on a particular project is in Ghana. It's called Newborn Screening for Sickle Cell Disease. In Ghana, we do not have a national newborn screening program like we have here in Canada. And so we're working with two partner hospitals where we have point of care testing. We train community health workers, midwives to use a point of care testing technology. And then positive cases are then referred to the clinic that we've established within these two clinics. So that's the model. Have an SCD clinic in a hospital, then train healthcare workers to use the point of care device. But there's a third layer. If the hospital cannot take care because of a complicated case, they refer to a hub or a specialized facility. So that's how the project is set up. One of the needs that has come up from our stakeholders or partners, clinical teams in Ghana, is the opportunity to, have these consultation discussions where maybe some of the difficult cases that they encounter in clinical practice, they can get some information, some education on. And so currently I'm tasked with kind of coming up with a framework that will help with that. And I'm just bouncing some ideas, but I wanted to know, you guys, I know you've also just started, but I wanted to know, and I know Ian has touched on some of them in the last comments about education, capacity building, and all that when it comes to case management. But I wanted to know whether you have some existing structure in terms of how, clinicians in your hospitals can be supported as they work with, Sickle as a specialist hospital, as an institution that has been in this game for a while and all that, Yeah. Thank you.
Thank you for sharing, Stephen. And I'm going to ask Ian to answer that question, but I also want to share Let's Connect. I think it would be amazing to have you join our co-design sessions and, really think about the next grant. And maybe there is a global sort of piece to that education that Listra spoke so eloquently to. So let's connect. Hopefully you can come alongside
Absolutely.
us and join as a
Absolutely.
partner. And
Yes.
Ian, I'll let you speak a little bit to that question just around the education again across. I think it's similar to Angela's, but a little bit more specific.
And just to mention that I work under Professor Isaac Odame, who some of you know.
Oh, yeah.
Amazing.
All right, thank you.
Yeah, I don't know if I have anything else to add really after my response to Angela around the education. It is something that, I don't know if I have much to add. My apologies. I'm just thinking that we also, like SCAGO itself, so as an organization, SCAGO has many educational resources available to healthcare professionals. And so any of the work that our team is thinking about doing with our next stage of funding, since we were successful with securing additional funding through the Leong Centre to further this work through some co-design, will include SCAGO as a partner, and we'd be very interested in, I'll speak for Diane's the NPA, she's the principal investigator on that piece of work, the next phase of work, but we'd be very happy, like she said, to include you in some of this thinking. There is some thinking around furthering the development of educational materials, centering lived experience as part of the next stage of this work. We've taken similar approaches across other project streams where right now we're doing a project completely separate on type 1 diabetes and the experiences of teenagers living with type 1 diabetes and how they experience stigma and discrimination in schools. And so that project, teenagers with type 1 diabetes made these digital stories, which are like YouTube shorts, and we developed these educational awareness accompanying materials that we want to test in school systems so that kids and teenagers are just treated better because people are aware of what the condition is, myth busting, stigma busting, like kind of classroom idea that is going into the next stage of work. And Dianne has been working with community partners in the area of intimate partner violence and family violence, similarly to help educate healthcare professionals around identification and screening and support. And so this is work that we have ongoing in other areas. And so there is an interest that has emerged through some of the work we've done here to really think critically about how we're educating healthcare professionals, how we are educating people, just the general public, how we are challenging systems and structures around how they care for people. And really what we found as a team is how we evoke, trying to think of the right words. So my apologies as I'm stumbling. It's evoking the deep empathy and compassion. It's really our experience is that it's through centering the lived experience, whether that's through narrative podcasts, like we did in an earlier project around weight bias and stigma, whether it's digital stories. There are many, many modalities to do that. And that is some of the things that we've been thinking about as a team. And really, our experience has been that having people with lived experience lead this work alongside us is really the right way to do it from an educational and capacity building perspective. So more to come. Anything, Dianne, you want to add to that?
No, I just think the partnership, like this is how the work continues is through partnership. So thank you, Stephen, for sharing. And we hope that yourself and then others on the call that might be interested will be excited to come alongside us as we continue to learn.
Thank you for that great question. We have 5 minutes left in the session, so I'll do one final sweep to see if there are any additional questions from those in the virtual space for our presenters today. I'm sure if there are lingering questions that emerge after today's session that the team would welcome those questions sent via email, so I can circulate that after today's presentation if you're interested. Perhaps I will ask maybe a question. I'm looking at who's on the call, and potentially this one will strike a chord and some potential future opportunities of collaboration as well. Around what elements of your model do you think are transferable to other pediatric chronic disease clinics? And what do you think has to be redone from scratch when you're engaging with new communities?
I wonder if I'd love for Jennifer and Listra to have a chance. Jennifer, do you want to try and talk a little bit about that one?
Sure, I'll go ahead. I mean, in terms of what worked well, I feel like, our implementation of the three phases, such as the critique, fantasy, and implementation phase, was a really good one to use because I feel like, regardless of age range, it really worked for everyone. When we focused on the children, the younger children, they were able to express their ideas through different means. And so it was, I want to say, an easier and more comfortable way of gaining the information that we needed, of really grasping the experience that they've been going through. And so using that for the service providers and for the caregivers as well was really helpful. And so I'd say this model is really something that I bring to different research as well. And I feel like the usage of research assistants as well helps a lot because when I kind of compare this to other research I read, I feel like this work is so grounded in lived experience that I feel like it kind of transformed the research that we've had, the findings that we've had. And so grounding lived experience throughout any project that you're doing, I feel like is really important and very crucial and central in making sure that the community is actually being heard and that we're not just, you know, getting information that we think might be relevant for the community, but that isn't something that community is actually living through.
So well said, Jennifer. Lister, do you want to add anything as sort of a closing?
I think Jennifer said it just perfectly. I think, in any sort of advocacy type work that you do, hearing that lived experience and really finding a way to make it, so that it is applicable to the community, in gathering that information, building that trust, and really helping them to see why this is important and also how they can see and reflect themselves in it. Because coming from like the research piece, sometimes that can be a bit tricky. And this model really helped us to be more engaging with the community, being creative and being able to, put together an event that really was to really build that trust and also to gather the information, but in a way that didn't feel like research really. So I think it's certainly transferable to other areas and other aspects of research or different, other health conditions or other things. But I think just being able to really work with the community, of course, Jennifer and I had that lived experience, but we felt that we were still be able to still learn from our other community members and other lived experience individuals and caregivers to really move the work forward in a way that, like she mentioned, didn't really feel like it was research in a way. So I think it works, and it was definitely an important piece of really getting to the end sort of goal.
Thank you so much both for that thoughtful response to the question. Again, I'd like to thank our presenters for joining us today and sharing a little bit about their incredible work in this space. I want to wish you all a wonderful day. This is our last community engagement series event before we take a break for the summer. So we will be re-engaging in the fall. So look forward to announcing our next session in the September Leong Centre newsletter. Have yourselves a wonderful rest of the day. Bye now.